Dr. S.R. Ramakrishnan, Professor of Medicine and Consultant Physician in Sri Ramachandra Medical College, Porur, Chennai. Our today's discussion will be on what high blood pressure is and how to prevent it. Generally, everyone would like to have healthy or normal blood pressure, but what exactly does it mean? So each time when the heart beats, it pumps blood into the blood vessels. This creates pressure against the walls of the blood vessel. This is called as blood pressure. In healthy persons, the blood pressure rises and falls throughout the day, but when it remains high for a longer time and left untreated, it can lead to serious health complications. In general, persistent increase in the blood pressure higher than normal is known as hypertension. High blood pressure usually develops over time. It can happen because of unhealthy lifestyle choices. For example, not having enough regular physical activity, obesity, smoking, alcohol consumption, stress, etc. The risk factors are age. As people get older, the arteries can stiffen up and narrow, and as excess fat builds up in the arteries. Family history of high blood pressure. So one or more family members with hypertension increases the person's risk of developing hypertension. Excess salt intake can lead to high blood pressure. Not eating enough foods which are rich in potassium and magnesium can raise the blood pressure. Eating processed and fatty foods increases the fats throughout the body and raises the blood pressure. And stress, reacting to stress in unhealthy ways and not managing stress appropriately can raise the blood pressure. Blood pressure is often called a silent killer because usually it does not cause any obvious signs and symptoms, but it puts the people at risk for several diseases like cardiovascular problems, kidney failure, stroke, eye damage, and blindness. So hence, accurate and diagnosis is very important in the management of hypertension. If the patient is experiencing any symptoms like early morning headache, tiredness, vision changes, buzzing in the ears, fatigue, nausea, or vomiting, they have to check the blood pressure immediately. Fortunately, high blood pressure can be easily diagnosed with an instrument called sphygmomanometer. Blood pressure is recorded in two numbers, systolic and diastolic. A normal blood pressure should be less than 120/80 millimeters of mercury. The upper number indicates systolic blood pressure, which means pressure in the blood vessels when the heart contracts. And the lower number indicates diastolic blood pressure, which means the pressure in the blood vessels when the heart rests between the beats. If the blood pressure is more than 140/90, it is known as hypertension. On May 17th, we celebrate World Hypertension Day, a day dedicated to highlighting the importance of monitoring blood pressure and bringing global awareness to the 1 billion people living with high blood pressure worldwide. The theme of this year's World Hypertension Day is measure your blood pressure, control it, live longer. Ensure that your blood pressure is measured and control if it is elevated. This risk can be prevented by taking few steps like regular exercise, healthy diet, quit smoking and alcohol intake, regular blood pressure monitoring, stress management, and adherence to medicine. So regular physical activity or exercise makes person's heart stronger. If one have a strong and healthy heart, it can pump blood pressure, more blood with less effort. So the heart has to work less to pump. In other words, we are all aware that age and weight gain are the two major risk factors for high BP. So if the blood pressure is at a desirable level that is less than 120/80, then exercise and help it from rising as you age. Regular exercise also helps you to maintain a healthy weight, which in my opinion is an important way to control your blood pressure. So one should aim for at least 30 minutes of aerobic physical activity most days of the week. High BP can be reduced by doing regular structured exercise such as brisk walking, jogging, swimming, etc. Second is healthy diet. Diet also plays an important role in controlling blood pressure. So the diet recommended is DASH diet, that is dietary approaches to stop hypertension. So the DASH diet is rich in whole grains, fruits, vegetables, and low-fat dairy products. And this can reduce the blood pressure by up to 11 millimeters if you're having high blood pressure. Second is eating less saturated fat and total fat, and getting plenty of potassium and magnesium through fruits and vegetables. And sodium, reduce sodium in your diet. Even a small reduction in the sodium in the diet can improve the heart health and reduce blood pressure by 5 to 6 millimeters of mercury. So if you have high blood pressure, to decrease the sodium in your diet, you can consider tips like read the food labels. If possible, choose low sodium alternatives of the foods and beverages you normally buy. Eat fewer processed foods. So only a small amount of sodium occurs naturally in food. So most of the sodium is added during processing. So avoid processed food and eat natural products. Don't add salt. So one level of teaspoon of salt has 2300 milligram of sodium. So avoid adding extra salt to food. Use herbs or spices to add flavor to your food. Stopping smoking. So stopping smoking helps you to reduce the blood pressure return to normal, and quitting smoking reduces the risk of heart disease and improve your overall health. Then regular blood pressure monitoring. So it is not always possible for patients to visit doctors and check up the blood pressure. Hence, most often I advise patients self-monitoring of the BP levels. So self-monitoring helps persons to measure BP at different times throughout the day and over a longer period of time. It also assists the doctor to get a more complete picture of person's blood pressure reading at different times and helps us in better prediction of cardiovascular morbidity and mortality rather than a single routine BP measurement in the clinic. Next is stress management. By learning how to relax and manage stress, one can improve the emotional and physical health and lower the blood pressure. So stress management technique includes exercising, listening to music, focusing on something calm or peaceful, and meditation and yoga. Last but not least is adherence to medicine. A medicine to lower blood pressure may be recommended by your doctor if your blood pressure is consistently high, so usually above 140/90 millimeters of mercury. So adherence to medicine is very important as it controls your blood pressure regularly. At last, I would like to suggest that there is nothing more precious than having a fit and healthy life. Adapting healthy lifestyle can help us to enjoy long and healthy life. So high blood pressure can be prevented as well as controlled in many ways. Keeping blood pressure in the normal range is very important in preventing cardiovascular complications. It is very much possible to maintain blood pressure levels with regular monitoring and preventive care. Thank you, one and all.